Hey guys, welcome back to another exciting episode of the Cancer Free Reality Show. My name is David D, and I'm here to give you an update on what's been going on in my progress. I just finished up the first cycle of my cancer free treatment. Um, it started out with a full week of chemotherapy. I was taking three different types of drugs: the bleomycin, etoposide, and cisplatin for the testicular cancer. And the first week, I went through a full week, 5 days of it for about 5 to 6 hours a day. And then the second week was on a Monday, was just one drug. And then this past week, yesterday, went down to MUSC and got my third treatment for that, my third week. And that completes the full cycle. Now, I can't say that it's been all happy and fun, but last week I went into the hospital. My white blood cells were wiped out, and I was dehydrated, even to the point where I just couldn't drink that much fluid anymore, and they had to pump it in me through IV. So my wife was getting concerned, so I obviously gave in and went down to the emergency room. They set me up there. They put me in fluids, and they wanted to admit me. And of course, I refused because I didn't want to be susceptible to diseases down there. Who knows what you can get at the hospital with so many germs and so forth. And with my immune system being totally eradicated, I didn't want to expose myself to that disease. So they went back, they contemplated with the other doctors, they came back to me, say, there's other diseases you can get other places. I say, yeah, I understand that, but, I just need fluids right now. And, well, we'll give you the fluids and this and that, and we'll be able to help you out over here. So I said, well, okay, just talk to my doctor, see what he says, and we'll go from there. Because, to be honest with you, the emergency room doctors and nurses, they're great and they handle care, but they're not sure how to handle this type of problem. If you're an oncologist patient, you have to definitely specify that you're an oncology patient and that you need to talk to a specialist because they don't know how to treat these type of symptoms and things like that. So just a tip that you want to know before going into the emergency room. Um, let's see, the other things. So they talked to my doctor. He said, that's okay, give him the fluids and admit him. So I was admitted on Friday night and got out on Sunday. They gave me plenty of fluids. The irony of it all is, over the last couple of weeks, I just haven't felt like eating at all. And which was interesting because when they brought the hospital food, I was hungry, and even though it didn't taste good, it was bland. I ate it, and I was shocked. I was shocked that I ate it, and to me, because I was hungry, it was good. So that was interesting, and so they gave me a couple Neulasta shots in order to bring up my white blood counts cells. It went from a 0.3 to a 0.6 the next day, which is a whole big 3 cells. So it was increasing, not by much, but it was good. Um, and then, let's see, Sunday they let me go, and I felt great on Sunday. Of course, they gave me like 4 liters of sodium chloride. They fill my, fluids back up, which was good. And I had to get ready to go down to Charleston, 5:30 in the morning on Monday. So I got out of the hospital on Sunday, went down to Charleston yesterday, and got my treatment, which was good. Talked to my doctor. He says everything's fine. The treatments will go as planned. I'm not going to deviate from the percentages and the amounts and doses that I give you because your cancer is different, and it has to be treated differently. But I can treat the side effects and the things that you're going through. So we'll attack them, with these type of drugs, and then we'll go from there. But you should be fine. We're going to proceed with the treatment. Next week will be your next cycle, and you go through a full week, and we'll continue on from there. So, but I really like my doctor. I'm blessed to have him because he knows what he's talking about. He's experienced in testicular cancer patients, and I'm really happy to be there. And so I'm grateful for that. And then so I feel great today. I felt great yesterday, even though he said I was kind of pale. But I feel like I'm always pale nowadays, I forgot to tell you about the mouth sores. The mouth sores were so great that I had to, it took great pain to eat. And that happens because of the side effects. Had both sores on both sides of my mouth, which was, you want to stay away from anything that's acidic, any juices like that, any spicy food, but to me, I love spicy food, but I have to maintain a tolerance, and just suck it up and just eat it and just go, because I wanted to eat. I'm hungry. So, but they're going down now, which is good. Thank God for that. There's a magic mouthwash that you can take for that. That's prescribed. That you can get through the pharmacy. They call it magic mouthwash, and that helps out a little too. Let's see. The other thing I wanted to say was that I feel good. Oh, and then the other side effect that's coming to pass is the loss of my hair. I'm actually starting to lose my hair, and it's quite interesting. I don't know what to think. Do I shave it? Do I just let it go? Be a natural process? I don't know. Should I do a mohawk? Should I do all sorts of crazy things? I'm not sure. But it's getting to that point where, okay, I finished the first cycle. I'm starting to lose my hair. So who knows? Maybe it'll become more blonder when it comes back. I don't know. So I don't know. Give me your tips. Give me your ideas. You can write to me at info@cancerfreetreatment.com. That's info@cancerfreetreatment.com. You can also go to cancerfreetreatment.com, and there I have some information for you about testicular cancer and the other things that you can do, the side effects that you can expect if you or your loved ones come down with this nasty disease. And if you want to write to me, comment on my blog, comment on my articles that I'm writing, because I'm also writing my thoughts out loud, letting other people know what I'm actually going through. And so maybe it can help you. Maybe you could pass it on and help someone else. So thanks again. I appreciate you watching. This is David D, and I'll be talking with you soon.